Health visitors are really important to deliver because they're skilled in public health. They are skilled in recognising the needs of children, babies, young families, and they're actually skilled in being able to find the tools, techniques and support to enable young mothers, young families, young parents to look after their children in the best possible way and give those children the best opportunity.
I became a health visitor by default really. I was doing my nurse training, I'd previously been a nursery nurse, and really wanted something that fit in with family life, and I absolutely loved it and luckily progressed to where I am today. I'm team leader for approximately about 26 staff. I share it with a colleague and we've been in post perhaps for about 3 years, and the reason the post was developed was to really improve services to local families and communities and actually raise the standard of health visiting.
In my nurse training, I did 7 weeks in my first year of my nurse training with the health visiting team, and I really enjoyed it. I enjoyed working with mums, I enjoyed working with families, and I think it was that sharing of knowledge that I really liked and I found that really interesting. The health visitor training was a really challenging year. It was assignment after assignment, lots of exams. It was intense and it was deadline after deadline, but it was really good. It was worth it. I'm glad that I've done it. We might have a clinic in the morning, so mums come in, get babies weighed. There might be a number of problems that mums ask you questions about at the clinic. We'll be working out in the community, maybe in the afternoon, going to mums' houses and seeing new babies. We'll identify what the mums and families' health needs are, and then we'll provide the services to support the mum.
There's a greater expectation and a greater public policy demand of health visiting, which means that can't be delivered unless we are supported to do so. So I think that's going to happen. I think it already is happening. Really, it's a good time to come into the profession.
The services we offer locally, again, are governed by the Healthy Child programme, which we're actually currently working to nationally. We have a lot of local input into the children's centres. So the strong links that we have with Barnardo's have been helpful to actually do a lot of joint working. So we might look at developing courses around toddlers, baby massage, infant massage. We might look at maternal mental health issues and how we support that. We work very closely with the midwives and provide breastfeeding workshops and clinics and support really.
I think how important the health visitor is varies from one family to another, so it goes across the whole range. For some families, they shouldn't not know why the health visitor is here. It should be pretty obvious, but their need for the health visitor intervention is probably minimal. Everything's okay, they're very autonomous, they get on with their lives, and the child is healthy. But for some families it's quite the opposite of all that, and the intervention of the health visitor can be vital.
The role to the families I serve, again, is very individual, because families they're all unique. That we can't go into one family and do the same thing each time we go in. Their needs are different. So, for instance, we might go to a young person who is living with their parents, and the needs of that family have to be tailored to what